In my course of service delivery, I also encounter people who have done criminal abortions, and they come in at different stages with different reasons why they did it. So it's a challenging situation because it is between life and death, whereby my role is to make sure that someone's life is saved. And normally the people who come in are of vulnerable age, like adolescents, who cannot manage themselves very well, who have done it secretly and in a crude manner, meaning that they do it in unsterile procedures. I remember one time I got a young girl of 17 years at the facility. She came in at around 4 p.m. when she had overbled. She was so weak, and on examining her, she was very anemic, that the level of our facility could not manage her situation or condition. So the only thing we had to do was just to refer them. Unfortunately, the parents were not well financed enough to quickly find means of transport to a bigger health facility which could transfuse the girl and save her life. However, they managed to leave the health facility because they had to, but when I tried to follow up, I realized that that girl died. Because when they left the facility, they didn't go direct to a hospital. They first went back home to find means of getting money to transport her to the facility where he had referred her. So what do I say about these unsafe abortions which are going on, many of which we don't even receive in health facilities? We can't know them. We are saying that responsibility goes to everyone in the country. Not only the girl who has got pregnant, not the parents alone, not the neighbors or the law enforcers, the policymakers, but all of us collectively, plus the health workers, we have to work together and see how we can calm down the situation or reduce ideas of aborting in our young girls, most especially. So we find that policies in Uganda, the law does not accept or allow abortions. However, it has some exceptions, like in cases where the pregnancy is life-threatening to the mother or to the owner carrying it, situations when the conception is not a human being, the moment it is realized, then there it allows to be terminated. However, I would feel if we could all empower these girls on life-saving skills such that they are able to negotiate it out, not to have sex. We give them information, the correct information about how someone can conceive. Because some of them are deceived when you take history. You say, someone told me to swallow Panadol before sex, I will not get pregnant, which is wrong. So we need to sensitize the communities every now and again using public medias, radios, TVs, local radios in our villages, showing these girls that you cannot just use Panadol to prevent pregnancy. Health workers should be encouraged to provide family planning methods, particularly to prevent unwanted pregnancies, and even information about the complications of abortion that can occur when someone does it in a wrong way. So these exceptional abortions which are allowed, like in cases of life-threatening conditions, in cases of abnormal pregnancies, they are done in sterile procedures. They are done in a health facility, in a sterile environment, such that someone does not get an infection to death or to lose the uterus. We also would like the law enforcers to find a better way of handling this. The moment the police or the law enforcers are got to be told that someone is aborting another, like a health worker in his clinic is performing abortions, they come in the hard way, they sue people without even giving the knowledge about what they should do. I would wish that law enforcers could come in an amicable way, in a way of trying to educate both. Yes, they can punish, but not in a rough manner. So if we could at least give information from all corners And then the policies can change to even school policies, where girls can be empowered to have the life skills, to be assertive, to build their decision-making skills, to have a self-esteem that is high. Someone to know that even if I don't sleep with a young man, I can keep alive, I can be strong, I can reach where I want to go.